about the future of medicine, leadership, entrepreneurship, or simply living healthier and happier, this conversation is for you. Welcome back to Healthy and Happy Living with Tiryãq, the podcast where we explore the ideas, innovations, and leaders shaping a healthier future for all of us. I am Dalia Gamil. Hopefully, you can hear my smile. Today's episode is a powerful conversation about reimagining healthcare, not just a system that treats illness, but one that builds health, resilience, and longevity. I'm glad to welcome Dr. Nermine Raouf, co-founder and managing partner at Doclinia. Dr. Nermine is not only a healthcare professional, but is also a system thinker, an entrepreneur, and a leader committed to transforming how care is delivered today. Welcome, Dr. Nermine.
Thank you, Dalia, for having me, and thanks to Tiryãq.
Thank you for being with us today.
I'm so happy to be here.
As a start, we want to know, how did Doclinia start?
Okay, good question. So actually, after years in healthcare, I started noticing a pattern. So people don't just ask about treatment, they ask about a much simpler question, like where should I go, which doctor, which hospital? And it's not always obvious, to be honest. So if we look into a rare disease condition, to find the right expertise, it sometimes is not even in the same country. So it's not only about a hospital, sometimes it's about a specific team or even a specific doctor. And that kind of clarity is not easy for patients to access.
I can feel you.
Yeah. So even if we look into like more common conditions like oncology, I noticed something else. Patients often need to hear the same plan more than once, not because it's not explained well, or but because mainly they are overwhelmed. They are processing the fear, the uncertainty, and they just need reassurance that they are on the right path. So the gap was never medical expertise. The gap was clarity, guidance, and confidence. And that's where Doclinia came in.
So it's more of a therapy.
Kind of, we don't replace doctors, but we help patients understand their journey, connect them to the right expertise, and move forward with confidence. So, as you know, today information is everywhere, but the part that's missing, which is guidance, that's what we were trying to help with.
Dr. Nermine, how good healthcare systems complement the need of having best doctors? We want basically some highlights about innovation, systems, and leadership.
So what I've come to realize in the places like UAE, that access is not the main issue. Patients already have access to excellent doctors and advanced facilities. The real challenge is how care is experienced. So today, patients often move between multiple providers. They receive good care at each step, but without a clear structure, it can feel fragmented. I've seen before, like a case, for example, Crohn's disease. The patient might be seeing a specialist, adjusting nutrition, managing stress. Each part is important, but not always connected. So the patient ends up trying to bring everything together on their own. And that's where the opportunity is, because we know coordinated care leads to better outcomes. So innovation is not just about more technology, but it's more about integration. How do we bring clinical care, lifestyle, and patient understanding into one clear path? Definitely technology can help, but only when it simplifies things, not when it adds more noise and complexity. And from a system perspective, better coordination improves efficiency and definitely avoids unnecessary repetition.
For sure. This takes us to telemedicine as the future of healthcare models. Please talk to us about telemedicine as an access equalizer.
Definitely, COVID accelerated the use of telemedicine. And we're seeing the shift now, like how people want to access care you find people like busy executives or working mother, sometimes people like constantly traveling. They don't need more healthcare, actually. They need healthcare that fits in their lifestyle. So I would say that's where telemedicine becomes very powerful, especially for areas like mental health, nutrition, lifestyle. The virtual care like really works very well. And we have seen patients, they stay more consistent when care fits in their daily routine, daily plan, instead of being postponed. So I can maybe take a call or see a doctor between my meetings or my break. And definitely, it's not about replacing the traditional medicine, but more about complementing it. So we still need the in-person care for diagnosis, for procedure, but once a plan exists, I would say digital care helps sustain it.
Sure, I agree 100%. So if we talk about the human-centered care part of the operations, highlighting mental health and emotional intelligence, why do you think mental health can be separated from physical health?
Okay, first, I love the part of emotional intelligence. It was my thesis in my MBA master's. So, and definitely I'm passionate about mental health and this part that I would say the connection between both emotional intelligence and mental health, it comes down to awareness and regulation. So emotional intelligence is the ability to recognize what we're feeling, we understand it, and we manage it. And mental health reflects how well do we do that over time. So because stress is not only like one big event, it's usually an accumulation of daily pressure without enough recovery. So when someone is not aware of what they are feeling and doesn't know how to process it, that where the stress is built up. So over time, it shows as an anxiety or poor sleep or exhaustion, burnout. And we know that all this kind of things affects our body, not just our mind. So it increases inflammation and impacts our immunity and drains energy. So emotional intelligence become very a practical tool. It doesn't definitely remove the stress, but it changes how we respond to it. It creates a kind of a pause. And that pause allows people to regulate instead of react.
Sure, sure. And this is the lifestyle now. We all need to manage our stress.
Exactly. That's so true.
So everyone is looking for healthcare around the region, knows they have support now.
Yeah.
This directs us to more prevention and lifestyle medicine to increase longevity. So why do you think healthcare systems are built around disease, not prevention? And now, it should be the approach to be prevention or health maintenance rather than disease treatment.
So true, Dalia. So one of the biggest shifts we need to have is moving from reacting to disease. So as you mentioned, protecting health earlier. So most of us, we only pay attention when something goes wrong. We see a doctor or go to a hospital when I have really something that I can't wait. We look from outside like we're fine, but not really well from the inside. We are tired, we're not properly sleeping, and we're under constant stress, as you mentioned earlier. And we're struggling sometimes with energy or maybe up and down with weight. And let me say that that's our early signs, not a disease yet, but not optimal health either. And that's where prevention matters. We know that from strong evidence that chronic conditions are influenced by lifestyle, nutrition, movement, stress, sleep. And those are not small details, to be honest. I mean, with lifestyle medicine now that shows, with all evidence, medical evidence, that they are central. And longevity is evolving, and it's not about only living longer life, but the quality of life we're living.
Definitely.
How to maintain function, energy, and this quality of life, it's only done if we start earlier, and that's the way where we can influence it.
Sure, sure. And it's been long since the Middle East started highlighting wellness packages, routine exams, and even America, Canada, and Europe, they are encouraging physicals every year. So people should start taking care of themselves with having those routine tests even before they feel sick, you know, just to maintain their health and make sure they stay healthy.
Yeah.
Not only caring for longevity, but for being healthy and improve the quality of life, as you just mentioned.
So true. I'm maybe, and I announced it a bit here, like a sneak peek. I'm working on longevity for executives. So those people who are busy traveling, have problems with sleep and with everything, and most likely they know their figures and numbers for their companies more than their own metabolic numbers. So how to help them to, you know, stay healthy, stay the leadership with stamina, and in 10, 20 years. So still under processing, but something that I'm really passionate about.
I am very optimistic about it. Sure, it will be a great success.
Thank you, thank you.
Talking about leadership, definitely we have to highlight women leadership and healthy teams. So where are the challenges you feel like women are facing in healthcare leadership?
Okay, so in healthcare, I would say leadership is not something on paper, it's something you feel it in action. You feel it in how a team communicates during a busy shift. You feel it when something goes wrong and people respond without confusion. I mean, I think we have all seen places with excellent systems, but the team is disconnected, and you feel it immediately. You walk into another place, maybe simpler, maybe not as advanced as the first one, but the team is aligned, communication is clear, and people support each other. So everything you feel it around is more controlled, more reassuring, and I would say that's leadership. It's not about the titles, it's not about how people the position or the place. It's more how people show up for each other. And as you know, in healthcare, small moments matter. So a missed message or a hesitation can definitely change outcomes. So leadership becomes about creating clarity, trust, especially under pressure. And when it comes to women leadership, I see it as a natural shift. So many bring strong awareness, communication, and the ability to connect different perspectives. And in healthcare, that makes a real difference. But at the end, it's not about gender. To be fair, it's about the team. When the team works well, patients feel it instantly, and that's what matters. So leadership here is not separate from care, but it's really part of it.
I do agree 100%. Highlighting teams together, everyone achieves more. So yeah. I do agree 100%. This takes us to the future vision of healthcare. So what do you think healthcare is going to look in 10, 15 years? Especially, especially if we're caring about longevity and quality of life now.
Yeah, so true. So I would say the same way we just started will continue and will be like maybe more like stronger. I would say like we're moving from reaction to anticipation. So we're moving toward more personalized, preventive, and data-informed models. We can now detect risk earlier, sometimes before symptoms even appear, and that changes everything. It's care is becoming more connected, I would say, and will be more. It's less fragmented, more centered around the patient. So personalization won't be or will be no longer just about the condition. It's about the person, their lifestyle, their environment. And the collaboration across sectors, I would say that will be more strong and clear, since we have already, the science, the tools. I would say the real challenge now that hopefully in the future will be sorted is the integration. How to bring everything together in a way that's simple and yet sustainable. So I would say the future of healthcare is not about doing more. It's about doing what really matters earlier and in a way people can live with, not just live longer, but definitely a better life.
Excellent. Dr. Nermine, if you want to give one message to future healthcare leaders and entrepreneurs, what it would be?
I would say healthcare doesn't need more innovation in isolation. It needs leaders who can align public purpose with private capabilities so that we can create systems that actually work for patients over time.
That's awesome. As we wrap up today's conversation, one thing becomes very clear. The future of healthcare is not just about treatments. It's about better systems, better leadership, and a deeper commitment to human-centered care. From the story behind Doclinia to the evolution of telemedicine, from prevention and lifestyle medicine to power of emotional intelligence, today's discussion reminds us that healthcare transformation requires courage, innovation, and vision. Dr. Nermine showed us that building sustainable healthcare systems means shifting from reactive sick care to proactive, preventive, and personalized models. It means empowering teams, supporting women in leadership, and embracing technology without losing the human touch. Healthcare is evolving, and so must we. Thank you, Dr. Nermine, for sharing your journey, your insights, and your vision for a healthier future.
Thank you so much, Dalia, for having me, and so happy to be in Tiryãq.
Same here, we're happy you're with us. And to our listeners, whether you're a healthcare professional, entrepreneur, leader, or simply someone who wants to live a healthier and happier life, where transformation starts with intention, this has been Healthy and Happy Living with Tiryãq. Until next time, stay healthy, stay inspired, keep building a life and a system that truly supports well-being, and remember to take joy wherever you go.